So I had this great conversation with a doctor here who studies Parkinson disease and treats people, and so we know that he has a huge heart for serving people with this disease. And so I asked him, do you have hope? Do you have hope that we're getting closer? And his answer really was encouraging to me, is that we're starting to understand the laws of this disease, and therefore once we understand the laws of the disease, we might be able to then find treatments where is the disease triggered versus where is it accelerated, and what are those things that can actually maybe halt it. So it fits into my worldview, which is if we know the laws of nature and we study those and we learn about whatever the laws of those disease or even the laws of organizations, we can treasure certain things and then make plans that might have actions that influence outcomes. So this search for knowledge that we're going on. So point number one is the connection between the laws of the disease and influencing health outcomes is a thinking model we've been using. The next takeaway and my thrill of the night, and also this morning and nightmares all night, was if we look at the idea of loving people through working better together, eliminating waste, so having a journey of continuous improvement, if we looked at that as a disease that we're actually trying to cause. So in the medical field, we're usually studying diseases to figure out how it starts and how do we stop it. But if we look at infecting a hospital with the idea that we can live differently, we can have higher quality, we can have lower costs, we can deliver much better care, and we can live joyful lives and stop stealing our time from our families and friends, that we need to start thinking about this as a thinking model to say, how do we make sure we cause the disease of improvement? So what are the triggers? What are the underlying things that are necessary for our organization to transform? What are those things that accelerate that? And also then, what does it look like when we succeed or fail? What are the indicators that we're causing the disease of improvement to happen? Again, following the laws of nature. You know, is there a law that says waste is bad? Do we know a lot about what causes waste? Do we give a darn? Do we care at all about what the impact that's having on us personally and with our families and our patients? Are we willing to admit that and go to our colleagues and say, can we make a plan to do something different? Will we take action, and will we literally apologize when necessary to say, I didn't know I was doing this, will you help me? So that we can live differently moving forward. So this conversation has really inspired a lot of thought and a lot of conversation this morning, and I'm looking forward to looking with doctors and nurses and medical care, the people in this industry, to look and say, oh, we have a model, diseases. Let's cause one, not just stop one.